I'd like to welcome our two Vascular Career Advancement and Achievement winners. First, Dr. Sabine Steiner.
Thank you very much.
Guten Morgen.
Thank you.
And, from Leipzig. And Dr. Osamu Iida. Ohayou gozaimasu.
Ohayou gozaimasu.
And joining us from the Kansai Rosai Hospital.
Yes.
So both of you have been recognized for being very promising, rising individuals. Just tell us a little bit about how you got to where you are now, where you started, and where you ended up. And we'll start with Dr. Steiner, because I know you've had some international experiences.
Yes. I maybe had a little bit unusual journey to end up here and to have this great opportunity. So I started early on in vascular medicine in Vienna, but I didn't go into interventional vascular medicine. I focused very much on translational science, lab-based science, anticoagulation, angiogenesis, so very much translational research then. As my career moved forward and my clinical training moved forward, I just felt my research is more heading towards clinical research. So I went then to Canada for 2 years to do a Master of Science in Epidemiology, to get a lot of training in statistics and stuff like that. So very, very different again. And actually, I was specialized already in vascular medicine, but haven't really done interventions because I thought I would become an intensivist, because that was
interesting.
Yes, it is. But then somebody offered me to join the interventional team, and I really liked it. I was really surprised how interesting, fascinating the work is. And then I decided, well, I really want to go deeper and to get more training, because we didn't have the caseloads back in Vienna at this time. So I went to Leipzig as a guest physician actually for 3 months. I had 2 months of holidays left and 1 month of unpaid leave. So I could organize a 3-month stay there, and then I got the offer from Dirk Scheinert to join the team. And so that was a really deep dive into interventional vascular medicine, as I spent 10 to 14 hours a day in the cath lab at this time, so that was really a nice exposure, I would say.
Hopefully with good radiation protection.
Well, with Andreas Schmidt, honestly, he really cares about radiation a lot. It's an ongoing discussion.
So, it's quite an interesting pathway. And,
it's a bit unusual, yes.
Which is great. I think the more different experiences you bring to what you're doing, the better. And just so for our listeners, angiology is a little bit unfamiliar to many of the U.S. Listeners of this. So
there's not really a real pendant to that, I would say. So it's first we specialize in internal medicine actually, so I'm an internist, and then you can choose a subspecialty like cardiology would be. There's also the field of vascular medicine. And but there's, of course, the conservative way of doing duplex ultrasound and treating outpatients and so on. Actually, in Vienna, we were pretty active at this time also in an interventional way, as Erich Mina was doing the absolute stent study and so on. So I got an exposure there, of course, but I was not really part of the interventional team at this time, but I joined it then, I would say, a bit later on, yes. And so I actually gave up my career as an intensivist, I would say. But I did a lot of training in intensive care medicine, and I have to say it's a very good background to do interventions, because we do not have an anesthesia team on a regular basis. Right. So we do a lot of sedation ourselves, and so this is really, really helpful for daily practice, I have to say,
also
looking
very
back.
Sick patients and complex patients, and
exactly.
So you're used to all this.
Yes.
Great.
Yeah.
So Dr. Iida, you have really focused on SFA and stent interventions.
Yes.
An impressive list of publications on this. So how did you end up getting to this point? You were a cardiologist by training?
So I started my career from the 2001. Now my turning point in 2005, because I attended the Leipzig Heart Center. I checked the all procedure by the Dirk Scheinert and Professor Andreas Schmidt. I saw that these procedures are very amazing. So from that timing, I'm just focusing on the SFA intervention. The SFA intervention is the many problem in currently. So that's why I'm very interested about the SFA intervention right now.
Yeah, and then you've been involved in a lot of the trials and devices in Japan and commented on these at an international level.
Yes, but I think the currently device is very mature, but all patient is not patent. This is a big problem. That's why I think this research is very important to solve the current problem.
So tell us a little bit about the practice of vascular care in Japan, and how is that? How many different groups are involved?
I think, as you know, Japan is a very limited situation. So we have a no atherectomy, and also the DCB is just started. And in my clinical practice, I'm a interventional cardiologist. I do the coronary intervention and the peripheral intervention, and also the aneurysm treatment. But based on the limited situation, always thinking about how to improve the patient outcome. That's why I studied many studies for improving the patient outcome.
And it seems to be some of the problems and the presentations of atherosclerosis are different in Japan.
Yes.
I mean, there are geographic, and we've heard in this conference, geographic gender differences in how things present, and it seems that's another challenge.
Yes, I think it's especially in the patient with CLI. We had a huge number of the patients with dialysis. We treated the patient CLI, the half patient on the dialysis treatment. This is a big problem in the clinical issue as well as the economical issue. As you know, the dialysis patient always complicated the vessel calcification, but we don't have used the atherectomy right now. So that's why I think I'm always thinking about how to improve the patient outcome, especially the very complex patient.
Well, you have an epidemiologist to your left, and you guys can get together and think about how to properly study this, which is one of the issues, right, is we just don't know quite how to study and what to study.
Thank you.
So Dr. Steiner, in the U.S., in the interventional world, we're very concerned about gender disparity within the profession, and I'm just curious, is that a similar issue in Europe? Just a relatively small fraction of interventionalists in the U.S. are women. We're trying to change that and trying to understand how to change that, but curious what your experience has been.
I think it's a really difficult issue. I think for me personally, I never felt a disadvantage being a woman, to be honest. But that this is really maybe reflecting my personal situation, especially in Leipzig. We are actually quite a number of women in the interventional team. But this might be unique because we are a big team, so there are coming up a lot of chances. In general, and having said that, the interventional vascular medicine area is small anyway, so that won't reflect
this
that.
This is the epidemiologist talking.
That's it. On the other hand, when we look at cardiologists, I can see this gender gap in Europe too. And the reasons, well, difficult to explain, I think, as in the US.
Yeah, but very important to have mentors, so you're in an environment where there are several people that you can look at and say, well,
Absolutely.
they can do it, I can do it, and,
Yes.
and I think that's what we're trying to change, in every venue and every way to provide these kind of opportunities. So I'm curious what you're thinking about for the next 5 years for you, what you are going to be focusing on, and what challenges you want to take on.
I think they're the same as the last 5 years.
So you're consistent.
Yes, consistent.
Right.
This is a very important point for me.
Great. Dr. Steiner, what do you?
Yeah, my life has changed always quite a bit. So no, I think I kind of found my destination, I would say. So I really think the opportunities I have at the moment in Leipzig are great. We are really focusing on establishing an even bit more dedicated research unit to bring things together, which is great.
Yeah.
I am in the great position that I can really balance my private life as I'm a young mother and my professional life very well, which I'm really grateful to dear China.
Congratulations.
No, but I think that, for example, is important for women too. So the reassurance you get that you're actually welcome after maternity leave, for example, things like that are really important. I think that makes a difference. And so I really want to balance these two things, my interventional career and contributing to our research, which is mostly clinical trials, establishing new treatment modalities, yes. Comparative effectiveness research, yes.
All very important themes, right? And
Sure.
I think it's been a pleasure talking with you.
Thank you very much.
It's been our honor to recognize both of you as future leaders in the vascular field, and I hope you enjoy the meeting and
It's great.
maybe learn something here that you can take home with you.
Okay, thank you very much.
All right, thank you very much. And
Thank
that's
you
it
very
for VIVA Unscripted.